Put an exclamation point on. While this may be highly transmissible, at least from the early evidence, and again, more information is still forthcoming, we want people to know that the early cases that have arisen are not life-threatening. They seem to be minor cases, and that is a source of good news for us right now. But in terms of the information we received, literally there are 5 cases identified today in the state of New York. The first one was in Suffolk County. I've been in communication with the county executive. At least one vaccination involved. This is an individual who traveled from South Africa, who tested negative upon returning to the U.S. on 11/25, and on November 30th, they took a point-of-care test, and they did test positive. And Northwell sent the results sent the individual to a lab, and that person did test positive. Again, a traveler from South Africa who arrived here and is a Suffolk County resident, a 67-year-old woman. Our second case is a Queens-based. The vaccination status is unknown to know whether or not this person had been vaccinated or not. Third case, similar situation. No other further personal details, but the vaccination status is unknown, Queens-based. And another case is from Brooklyn, unknown vaccination status. And we just received word of another suspected traveler case here in the city that was identified in the city, and what's in one of the 5 boroughs. So we knew this was coming, Mayor. We talked about this. You and I have been in communication already. No cause for alarm. We just want to make sure that the public is aware of information when we receive it. We don't have more information at this time, but we suspect there'll be more cases emerging. And the best thing that everyone can do is realize we're not defenseless against this variant at all. That vaccine, we know, is going to ensure that there's less severe symptoms. The booster is something I would highly recommend. If you're not vaccinated, get vaccinated. If you have vaccinations, both series, get the 3rd dose, which is your booster. Ensure that our children are masked up, as well as making sure that they get their vaccinations, of anyone above 5 years old. And also recommend that people continue to wear their masks indoors, and when you can avoid large gatherings at this time. This is not a cause for major alarm. I need to say that, because we do not have enough information. We're not having shutdowns. We're not changing our protocols. We are continuing where we are, but making sure that we work in concert together and encourage people to get tested often, get the vaccination, and that, again, is our best defense. Again, Mayor, I thank you for the continued relationship that we've had since the beginning of my term. Short time, but a lot's been happening, and I appreciate your leadership as we work through these issues together.
Thank you so much, Governor, and thank you for, there's been tremendous communication, you and I directly, but also your team and my team. I want to thank you for that. A very cooperative, collegial atmosphere, a lot of unity of purpose, and I want to say that to all New Yorkers. We are working together to protect you. We have a new situation, but we also know there's a lot of information we do not yet have about Omicron. We know we now have cases here in New York City. We have to assume that means there's community spread. We have to assume that means we're going to see a lot more cases. But we also have tremendous tools, as the governor said. We have a massive vaccination apparatus, and that is by far our best capacity to protect everyone against this variant or any other form of COVID. So the message today is, let's do the thing we know works with COVID. Let's get vaccinated. To all the parents out there of the youngest New Yorkers who have not yet gotten your kids vaccinated, the 5 to 11-year-olds, we need you to get your kids vaccinated right away. To everyone who qualifies for a booster and has not yet gotten it, we need you to do that to protect yourself and your family and everyone in this city. We know vaccination works. It limits the impact. We know this. It limits the impact of COVID. It helps reduce the spread of COVID. We need that more than ever. We are going to keep the public informed. The governor's made a commitment. I make the same commitment to transparency. We'll be constantly updating the public. But as the governor said, right now, the good news is there's a very strong healthcare team for the city and the state working to protect you, and that will be every single hour of every single day. As for what we learned about this conference at the Javits Center and these additional cases, our test and trace team is out there immediately working with each individual who was affected to figure out who else they came in contact with. That contact tracing is absolutely crucial. We have the strongest test and trace team in America, thousands of extraordinary committed individuals out there protecting you. They're going to make sure we identify who needs any support, anything in the way of medical support, quarantining, et cetera. Also, we're going to use every tool at our disposal. Earlier in the week, we announced a vaccine mandate for child care employees, about 102,000 child care employees. Earlier today, a vaccine mandate for employees of non-public schools. That's about 56,000 additional employees. Both of those go into effect December 20. There will be more new initiatives coming to protect people. The bottom line is we're going to use every tool at our disposal. Our healthcare team and Commissioner Dave Choksi is here with us for answering of questions. Everyone is committed to protecting all New Yorkers, and city and state working together in unity to get this done. With that, we'll take some questions. Stating the obvious, this is an urgent moment, on topic only. We welcome questions now from the media.
We'll now begin our Q&A. As a reminder, we're also joined by Health Commissioner Dr. Dave Choksi. The first question today goes to Emma Fitzsimmons from the New York Times.
Hi, good evening. So can you tell us all 5 cases here are believed to be mild, and only in the first case do we know that the person received at least 1 dose of the vaccine?
Yes, we only know.
Then Dr. Choksi, go ahead.
Yes, with respect to the information we just received from the labs, which is literally what happened within the last hour, we only know that 1 person has been vaccinated for sure, and that is the individual from Suffolk County. So that status is not determined. We expect to know it soon, and the symptoms were very mild. And again, we don't have a lot of cases to compare this to, but the individual from Minnesota, the first case that we spoke about today, again, mild symptoms, they recovered at home, and that is why we have to realize that this is actually the 5th variant. I thought it was the 4th, but we added up, it's the 5th variant, the Delta one that is still pervasive. We've had over 7,000 cases over the 7-day average, 5,300 cases statewide just yesterday from the Delta alone. And we don't know whether this is going to exceed that or replace the Delta variant as the #1 cause of people contracting COVID. So more information to follow, but we don't know the vaccination status of anyone other than the first one.
As I turn to Dr. Choksi, just emphasizing the governor's point, we do have a new challenge, but we have a much bigger current challenge with the Delta variant and driving a lot of real profound impact on families all over the city, state, and nation. So I just want to emphasize to everyone, job 1 is still dealing with the Delta variant. Dr. Choksi, anything to add on the cases so far?
Just briefly, sir, the governor and the mayor are exactly right. With those 5 cases, we are still gathering all of the details. We know that 1 of the 5, as the governor said, is vaccinated. It's very possible that others will also be vaccinated, but it gives us a chance to reinforce it's so important. If you or your child are not vaccinated yet, get vaccinated. If you are and you're an adult, get your booster dose.
Emma, do you have a follow-up? If not, let's go to the next question.
As a reminder, we're also joined by the Test and Trace Director, Dr. Ted Long. Next question goes to Jimmy Vielkind from the Wall Street Journal.
Can you hear me?
There you go. Yes, we can. Tape delay. Yes, we can.
Hi. So other than getting vaccinated, my first question is, other than getting vaccinated or boosted, if you haven't already, what adjustments to behavior, if any, are you recommending to New Yorkers?
Governor, would you like to start?
We're encouraging indoor mask use for sure. That is another way that people can have that extra layer of protection. But again, the boosters and the vaccination are the primary way to protect themselves. We don't have any evidence of another variation of this that require a different reaction. For example, if you remember in the early months of the first pandemic, the first variant, COVID initially, people thought that it was transmitted by surfaces. And so it was all about making sure that we cleaned our hands and took other precautions. So we're learning more information. We'll get all that out. But right now it's exhibiting the same kind of traits that other variants have had. So we believe that the booster and the vaccination are the way to go. But we highly encourage people to wear their masks indoors.
Yeah, and Jimmy, just quickly to say, The governor and I are constantly reminding people how important it is to get vaccinated. I want to say, particularly with the holiday gatherings coming, with travel coming, anyone who's thinking of traveling on a plane, on a train, anywhere around other travelers, get vaccinated. It's more urgent than ever to do that. Dr. Choksi, you want to add?
Thank you, sir. Vaccination is the single most intervention, as has already been described. Beyond that, masking and testing are important. Masking, particularly indoors. And testing is important, particularly around travel or gatherings. Beyond that, there are common sense precautions that we have seen have worked over the past 2 years. Stay home if you're not feeling well, and that includes mild symptoms. And if that's the case, get tested and then come back home. And then hand washing, particularly important right now as well. We have to deploy all of those tools together, but it starts on the foundation of vaccination. New York City is in a good place, but we have to drive even further.
And then, thank you. As a follow-up.
Yep.
As a follow-up, do we have any knowledge as to whether these 5 cases were related? It sounds like the Suffolk County is not to the
Okay, we've been listening as the mayor and the governor there telling us what we expected. Omicron, the variant, is in New York State, telling us that 5 cases are in New York, 1 in Suffolk, 2 in Queens, 1 in Brooklyn, and another one in the city. They're not specific on exactly where that is the case. They said the case in Suffolk is a mild one. They believe the other
Information about the people gathering at that convention from November 18th to the 22nd. So it's too early in the process to be able to identify who have been residents. But in terms of these 5 cases, again, Suffolk County, as you mentioned, is further out. I don't know that these people are in contact with each other or not. We don't have evidence either way. However, we also know that there's 2 people from Queens. We don't know even whether they're in the same household or the same neighborhood, and someone else from Brooklyn, and one where it's not been identified. So we'll be happy to provide that information the second we receive it. That's we want to let the media know and the public know that we're providing information as we learn it so people can take precautions. And if they believe they've been exposed or want to take a test just to be sure, the good news is that the White House today answered our request, which we've had in place for a long time, to make sure that private insurance companies will now cover your over-the-counter test kits, the antigen test kits. So those are on shelves right now. I encourage people to also make sure that they have those available. If they just have this anxious feeling or this sense, I want to know for sure that I don't have the variant or Delta or whatever else they may have, we want to make sure that people know that these are now covered by the insurance providers.
Thank you. Dr. Long, you want to add on the tracing of the cases so far?
Yes, sir. Thank you. So I really appreciate that question. As Governor Hochul said, we're learning about these cases in real time now. The first case, which we were just looking into right before this press conference, was actually an individual that had already completed our contact tracing intake, and we were able to offer that individual resources, and we confirmed with that individual every day as part of our usual monitoring that they are appropriately isolated at home and therefore not risking their friends, family members, or other New Yorkers. We're going to be doing that same process for all of the cases as they come in and setting up different chains of transmission to make sure that we're able to break chains if we see any connections to things like the events. I also just want to really emphasize something that has been said here, which is that in New York City, we've worked really hard for this day to build up a testing structure that has ample capacity to offer everybody testing. This week and last week on individual days, we did more than 100,000 tests in a given day, and the median lab turnaround time is 1 day, 24 hours in New York City. So if you're sick, or if you're going to a gathering, or if you've been traveling, come out, get tested now. Or in New York City, if you're a close contact, a traveler, over 65, or immunocompromised, call 212-COVID-19, and you don't even have to come out to get tested. We'll bring testing to your door, into your house, and test you for free in your home.
Thank you very much. Go ahead.
Next is Steve Burns from WCBS 880.
Hi, Mayor and Governor. I appreciate you doing this. I'm sure a lot of folks are feeling some amount of deja vu here to March 2020 when we were talking about, a few cases here or there. Obviously, the problem back then turned out to be much more widespread than we knew. So should we assume there are more than 5 Omicron cases in New York State at this point? And if so, why are we not seeing more proactive moves in terms of mask mandates, crowd gathering limits, things like that?
Steve, I just want to say, I'll turn to the governor, but just say it's a very different world, thank God, than 2020. Our hospitals have so much more ability to deal with the challenge than they did then. We have much better treatments available, and we have a huge number of people vaccinated. It really is night and day. But I think there's no lack of urgency. Everyone understands we're going to throw everything we got at this new challenge. We need to know more about it, but right now what we do know is get people vaccinated. Encourage mask use, encourage testing, and we're going to be doing that in a very, very aggressive fashion. Governor.
That's a good question, but I want to remind people that this is not March 2020. We have learned an enormous amount over the last 20 months, how this transmits, how we can deal with it, but also we weren't even close to having a vaccination. In fact, at the time, if you recall, we were told it would take minimum of 2 to 3 years to have a vaccine available. And the miracle of modern science and the hard work by many people in pharmaceutical companies in Washington, D.C., they were able to, within 9 months, have a vaccine available to our most vulnerable in nursing homes and our senior citizens. So that vaccination was and continues to be the game changer, the great differential. So people should not panic that this is going to be a repeat of what happened before. Again, we don't know whether this is going to be like the Delta variant, which has caused some hospitalizations, or one of the earlier variants, which never really materialized to be a serious threat whatsoever. We are taking this extremely seriously from the public health perspective. That's why you see this coordinated effort and the contact tracing, make sure there's testing available, that there's no shortage of vaccinations. I was in the White House yesterday talking about how I want to make sure that we have ample supply of vaccines going out to all the pharmacies. That's a direct line from the federal government to the pharmacies. The President's addressed that today with his winter response. So we feel good about this, but we're not complacent. We're not sitting back and saying we're fine. We're saying that we have so much available to us that we're ready to deploy. And with respect to our real concern, back then and even now, it is overcrowding of hospitals to make sure that we always have enough capacity for someone who either has COVID and needs additional care, medical care, or someone who has a heart attack or an illness, that they have all the medical care they need. And that is why less than 1 week ago, I instituted an emergency order for the state of New York, which gives me the resources to deploy the National Guard where we may have shortages in staffing, and as well as deploy people elsewhere within our state system of healthcare areas that are doing well, that we send staff, medical staff, particularly nurses, to those hospitals that have less than 10% of individuals, less than 10% bed capacity. We also stopped elective surgeries in those areas of vulnerability, and it's something that we can even expand those capabilities. So yes, I agree with the mayor 100%. We are in a far better place. The people are informed. There's not a panic. We're not trying to instill that. We're just trying to let people know we've got this. Have confidence in what we're able to do, because it's a different world right now. It is still a public health crisis, but it does not have to be a crisis that leads to the shutdowns when we did not have information, we did not have a vaccine, and we did not have the tracing and tools at our disposal right now. That is the difference between now and then.
Amen. And Steve, look, anyone out there who's feeling urgency at this moment, there's something you can do. If you haven't gotten the booster, go get it. If your child's not vaccinated, get them vaccinated. I mean, this is something where we need everyone to participate. And there's a lot of people who still need to come forward and help us get the job done. So we have the tools like never before, and the vast majority of New Yorkers are responding, but there's still folks can come out, get vaccinated, help us protect against this challenge. Steve, did you have a follow-up?
I do, thank you. I wanted to see from the governor's perspective if this changes your calculus at all on vaccination mandates, especially when we see, you mentioned the other day, such a stark disparity in terms of the problem spots upstate versus in New York City. Would you at all be looking at emulating what Mayor de Blasio has done in terms of mandate for employees, or something like the Key to NYC to go to restaurants or theaters or things like that? Does this at all change your calculus on vaccination mandates?
It also comes down to compliance, and I'm aware of the tools we have at our disposal. We have had even pushback with respect to our initial vaccine mandate, which was to have all healthcare workers receive a vaccine. I'm pleased that we have now 100% of healthcare workers who are working in nursing homes and in hospitals vaccinated. but that resulted in a loss of literally thousands of workers that we needed, which is why we have a situation now, one of the reasons we have a situation now to backfill those. So I know all the tools we have at our disposal. If we learn more about this variant, that it's different than we don't have enough information right now, but those are issues that I can trigger instantly. I can change the dynamic with the directive instantly, depending on the circumstances. So again, I don't want to overreact to this. The city of New York is different in that the density and how people work and how they travel together. The sidewalks are crowded, the subways are crowded, the public housing in particular, and all the apartments are crowded, dense places, and there's much more opportunity for transmissibility than we see elsewhere. That is a factor to take into consideration. The New York State workforce has a vaccinate or test to return to work situation now, and it's working very well. Our numbers of testing positive rates are very low. So I put this on the table of issues that we have able to address, go further, but I don't know enough about this variant. We're not going to overreact, but I can react that quickly if we need to.
Thank you. Go ahead.
Last question for today. It goes to Michelle Price from the AP.
Thank you, Governor and Mayor. I'm wondering, do any of these 5 cases move back the date that this variant may have been in New York? Do we know the earliest it may have been here?
No, we can say we know. Do you have details, Governor?
Yes, our case from Suffolk County looks like they tested positive on November 30th. November 30th was the date they tested positive at a lab in Suffolk County, and my understanding is that Wadsworth Lab up in Albany has been looking for these variants and looking to identify if it came through, and this lab sent the results, and now we have confirmation that it was November 30th.
Yeah, Michelle, I'm going to add and turn to Dr. Choksi real quick. I mean, we keep learning. We learned this in the beginning of COVID, that a certain amount of spread can happen that isn't even picked up by the most careful testing. So I just now want people to understand, we're assuming in New York City there is community spread at this point. We have to. That's the only way to approach this to protect everyone. We see a handful of cases. We got to assume there's a lot more behind that, and that it has been here for a meaningful amount of time. Dr. Choksi, you want to add?
Thank you, sir. You covered the most important point, which is how we should interpret it in the here and now, which is that the Omicron variant is here in New York City and in New York State, as the governor has mentioned, and that we are in a situation where there's community spread. This is not just due to people who are traveling to Southern Africa or to other parts of the world where Omicron has already been identified. So that's the most important sort of epidemiologic takeaway that we want to convey. In terms of the dates, between the exposure that we know that happened from the Minnesota case, as well as some of the cases that are coming to light today, it appears that late November is the date that we can say, with certainty. And we expect that, additional cases will be found as well. Remember that sequencing, which is the specialized genetic testing that is done to identify different types of variants, this often takes several days for the machines to actually process that test. So the initial PCR test will be several days before we actually get the sequencing results. And the governor and the mayor decided to communicate this because we received all of those sequencing results today, and in some cases just minutes ago.
Thank you. Go ahead, Michelle. You want to follow up?
I just wanted to ask about the sequencing to clarify. Is every PCR test, does it undergo the gene sequencing?
Commissioner?
The answer is no. There is a subset of PCR tests that undergo sequencing. It depends a little bit depending on the jurisdiction. For New York City, I can tell you we're sequencing about 15% of all tests, which is a very good proportion for us to be able to pick up these trends over time.
I want to give the governor the last word, but say thank you, Governor, for, again, the partnership, the communication, and I know you are truly committed to transparency, and that's what the public deserves, and welcome you to finish this up.
All right. Thank you, Mayor. I do appreciate that, and having the synergy between your health team and our health team should give New Yorkers confidence that the brightest people in this country and perhaps on this planet are working together to make sure that we keep New Yorkers safe. We'll continue to do that, and I look forward to working with you as we share information when we receive it, offer new strategies, anything that's going to be evolving or changing with respect to our approach to this. We'll certainly make sure the public knows, but right now we don't have a lot of information, but again, just wanted to share this with the public, and I thank you for your cooperation as well.
Thank you. Thank you, everybody.